So the technique we're demonstrating today is carboxytherapy. Believe it or not, this is quite an old technique and probably has been used for almost 80 or 90 years. It started its use in France during the 1930s. It was originally used to treat diabetic ulcers, and we know that if we created a situation where we injected carbon dioxide into venous ulcers, it induced a hypercapnic response that made the body fool the body to an extent that there was no oxygen in the area, so it reacted by growing new blood vessels and also new collagen. So we got both neovascularization and neocollagenesis. Stretch marks, like we have here, have always been very difficult to treat from the point of view that various methods have been used, from dermal rolling right through to fractionalized lasers in some instances, and also we have used things like peels with very little effect. But for the first time we have a technique where actually, if we can put carbon dioxide within the sort of tissue itself, we're really setting up a situation where we have lateral marks that are going within the tissue, so it's almost causing stress planes within the stretch marks. Now, stretch marks, as we know, are almost like stretched dermis without an epidermal covering on it, and as a consequence, if we fall, cut our hands, and we have oxygen with extrinsic mediators within any cut, we have a situation where we have new collagen grows, and technically that's what we're doing within these stretch marks as well. So I'm using a 30 gauge needle here, and normally we try and sort of enter the skin at an angle of about, I suppose, 15 degrees, and this is the sort of response we get here. Now the patient's face is obviously off camera in this situation, but how do you find the procedure? Is it painful, or is it?
Just a little uncomfortable.
A little uncomfortable, okay. Now this technique can be also used for periorbital rejuvenation, and it's amazing in terms of all the complex multitude of problems that we have around the eye area. They can almost be treated by the one technique, and this would include infraorbital fat pads. It would also include dark circles, and it also would include skin laxity, rhytides or wrinkles, skin luminosity, so vascular pooling. So we have a multitude of things that can all be treated at the one time. A patient like this here probably would require a treatment every 2 weeks for probably 60 treatments, and in my lifetime I certainly have never seen anything as appropriate for stretch marks as this. There's a lot of theories out there why it's so effective. It includes increased vascularity. We do know that it's obviously forming new collagen. I myself am a firm believer that we're probably creating an insult across the dermal tissue, and as a consequence, I was in here before a little earlier, so that's probably why it's not mounting as good a response as on the other side. So I think it's almost like doing laser or dermal rolling within a closed system, instead of having needles that are going down into the dermis, what's left of it obviously during stretch marks. We're sort of going in at the same plane as parallel to them, and so it's almost like, to me anyway, dermal roller at 90 degrees. Now stretch marks are a thing that particularly bother patients. Is that fair to say from my patient's point of view?
It is.
Yeah. Particularly, we know it's nice to have a male patient to treat, but females in particular, after having babies, Now the end point normally would be this sort of level of erythema, which is nice response. We know that we're going to get certainly a vascular response in that area, and probably also distension of the skin. So technically, for all purposes, we're finished.